You don't like it?
Hello, my dear FMG champions. We at DocTutorials, with all faculty members being here, we wish you a wonderful career in the country. The first step you have taken, and the exam is, cleared. All faculties over here are so happy to see so many students passing this time. And I would request our senior most faculty, JP sir, our forensic educator, to congratulate all of you on behalf of all faculties of DocTutorials. JP sir.
Good evening, my dear students. It is my privilege, Rajiv Dhawan said, asked me to congratulate all of you on behalf of DocTutorial family. And I think I'm the right person to congratulate, and definitely my teaching experience in forensic medicine is more than your age, because I'm in this field since last 32 years. Maybe my age is more than your father and mother. So, behalf of DocTutorial family, I congratulate each and every one of you for passing your FMG examination successfully. At the same time, I wish you all the best for your upcoming NEET or NEXT examination. Thank you.
Guys, we at DocTutorials, when we saw the result this time, believe me, in our internal discussions, each faculty member was so happy seeing so many students reaching the other side of the story now. And we all know that, once the exam is cleared, we are actually having a lot of question in our mind as FMG. And this meet is about mentoring you guys further, how to take the life further after the FMG is cleared. And the first stop is internship. Most of the students will be doing internship. And my dear friends, I would ask our pediatric faculty, your beloved Dr. Sandeep sir, to tell you what is the importance of internship in the life of FMG. Sandeep sir.
Hi everyone, very good evening to all the students who are listening to it. See, this is a common, query. As soon as the result comes out and FMG students clear their exam, they are in a quandary. Should we be going and focusing on our internship, or should we be, just doing internship for the sake of it and then going towards joining a coaching and then preparing for the next exam or new PG exam or NExT exam? See, my take on this is very simple. You need to first see what all is happening. If you look at the currently, the questions which are coming in NEET PG and NExT, the questions are becoming more and more clinical oriented. A lot of questions are being asked, which you will not be taught in a class, but you will be able to solve if you have sincerely attended your internship properly. And with the draft of NExT already stressing upon application of clinical skills and the focus on internship, as soon as the NExT gets notified, students, you can be almost sure that at least a significant number of questions are going to be, they're not going to be what is taught in the classes or in your guidebooks or your coaching material, be it any coaching material. It will be something which you see, perceive in the actual internship or in the wards. To give you an example, very recently there was a question. If you have to put a cannula and give normal saline in a newborn, what are the things that you will be using? And you had to choose among the options given. It was a multiple choice based question. Now, even if I take 15-day class for pediatrics, or for that matter, any pediatric faculty, they are not going to teach this. But this is something very simple. If you have attended sincerely your internship period, if you have observed what is being done, that you will be needing a set of gloves, what is the size of cannula that you should be using, and then after putting a cannula, you should be using a small syringe to flush the clot which has formed, and then you need a sticker or whatever things. So for these things, I think it becomes very important that you carefully, you place some importance in your clinics as well. End of the day, we are going to be doctors. You will be a specialist in one thing, but it is not about, the life is not about MCQs. You are going to be doctors. You're going to be treating the patients, diagnosing the patients, whether you move into pre or paraclinical, whether you move into clinical. So please pay attendance, please pay attention to whatever clinical sales that are being, that you are being taught. So take internship in a serious manner. Second thing, when you do internship, a lot of FMG students have an issue that they have not been exposed to a lot of clinical specialties. And so in this time, you will be forming an opinion about yourself. So tomorrow, if you are going to appear and get a rank, what are the branches that you are comfortable with? Like when I joined my internship, I got clear that, I don't like much of, blood bath. So the surgery and orthopedics and all those branches were out for me. So similarly, for some people, it might be an adrenaline rush. So you have to decide while doing it, and whatever branch you like, take it as a motivating factor. Use it to motivate yourself, and then utilize it for, when you prepare for the next exam. So all those next exam who are sitting for, please take internship seriously. At the same time, also keep an eye and keep reading. Whatever you observe, read from the MCQs, you integrate, you will never forget when it comes in the exam. That is my take, sir.
Wonderful, Sandeep sir. That's excellent, I would say words by Dr. Sandeep sir. Internship is very important. And I'll just give a small example that you read a novel versus you see a Netflix series based on that novel. I'm sure that Netflix series would actually create a bigger impact on the brain. You'll get more clarity of the things actually. So that's the same thing over here. And, I'll request Shivani ma'am to tell us that, how the integrated videos, which are part of the doctoral application, is going to help the students to understand certain topics in a more structured manner, along with the internship, of course. Shivani ma'am.
So first of all, congratulations to all the FMG students. We're really, really proud of all of you. And this time you have achieved great results with so many beautiful numbers. Like many students, they've got more than 200 marks, and this is such a proud feeling. And we at DocTutorials are actually believing that there is basically a hitch. Students, FMG students, they think that they're not able to crack the next exam. There's a lot of fear in their minds. So we at DocTutorials, we have curated all the course according to your needs. Like sir is telling you about the integrated videos. So we have almost 70 plus integrated videos where all the, such questions are being taken up, and 2 and 3 faculties, we have discussed the next pattern videos in such a manner that it really becomes very enjoyable, that you can learn in such a manner that, it is the need for the next examination. The integrated videos will be very helpful for you. So I'll request all of you to go through those videos once before you appear for your next exam.
Wonderful. Internship is very vital, we understand. But what, student get bifurcated between, shall I do internship or shall I prepare for the now PG examination or next examination? And, the whole thing is about creating a balance between the two things. And I will request our surgery teacher, Dr. Mahendran sir, to guide us that how can we do the internship also? And along with the internship, how can we use the e-learning resources to make sure that you're working towards the examination at the same time? Dr. Mahendran sir.
Congratulations, friends. I would like to tell you an important thing here is preparing during internship will be really difficult for most of you. But please utilize this internship, because as Sandeep has clearly told, internship, what you do in your internship is going to be coming as an MCQ. So when you are doing internship, the easiest method is, some of the centers where you join, the faculties will be very good. They will be teaching you everything. For example, if you admit a perforation case, the faculty in the ward can be teaching you how to manage a perforation. But don't worry if the faculties are not teaching you also, because at DocTutorials, we have all the videos, all the clinical videos. For example, if you want to know everything about perforation, just in one click, you can open in your app and you can see about the perforation. We have explained everything about which is not even there in basic books. We have explained in depth from even super specialty books how to manage a perforation. So like that, for each and every topic, all the clinical specialists have explained in depth about all the concepts. So don't worry. For example, if you're in the ward, you're admitting one case of a fracture or a case of ENT problem, one patient is being admitted, just open our videos. Just 10 minutes in your ward itself, you can open and put your headphone and you can hear the video. Everything about that case will be very clear, and even your faculty will learn from you. When you're going to explain about the facts, your faculty will be learning extra points. because most of the faculties will be not reading the books. They would have already doing their own practice. So once you tell some important point from our videos or what is there in our video, definitely they are going to learn extra. So please utilize the internship. I first of all want to congratulate those who all have internship. So I am seeing most of the people are getting frustrated for doing internship. But I will say doing internship in Indian medical colleges or Indian hospitals is going to be an extraordinary lifetime experience for you. It will be a special journey for you. You will enjoy each and every day. This is the place where you might be getting your life partner. This is the place where you are going to decide your lifetime course. Everything is going to happen in this 1 year. So this 1 year will definitely have a big change and miracle in your life. Meanwhile, this 1 year can be utilized to prepare for a next exam. So exams will come and go, but internship is more important. I wish you all do active internship, learn every day. Every day you should go home learning 2 diseases practically, not theoretically. You should see the disease, see how the patient gets admitted, how he gets treated, what wrong management has been done, what correct management would have saved him. Everything you should see day by day, and you have to learn from the mistakes of others. You cannot have time to learn from your own mistakes. It is the place where you can learn from the mistakes of the seniors, assistant professors. Even the professors can make mistakes which would have caused death of a patient. This is the place you can find out them, and you can prevent such mistakes in future. So definitely our application will help you in learning about the disease, even if they are not going to teach you in the words. Okay, all the best. We'll be there always in the app for helping you all over your internship. Thank you.
Wonderful.
Thank you, sir.
Thank you, Rajamandan sir, about these words. Guys, please look at this session. This session is a heart-to-heart connect between the members of same community. You are future doctors, and we have to leave the chairs for you to, fill those chairs. And this is actually, look at the words of sir. If you are doing the internship properly, what Sandeep sir is also saying, then you get fundamental concepts very clear in your mind. Along with that, we have to prepare for the national exit test or NEET PG, whatever is applicable for you. For that, now guys, going to offline classes with internship, we understand the challenges we have, definitely. That's why we don't call ourselves like coaching or something. It's an e-learning platform. And in 21st century with 5G in place, I would say that e-learning platform along with internship can be, combined in a very nice way where both the things can be taken care of. So that's what sir is saying at this moment. We have, our very, very loving Naveen Porwal sir, our physiology teacher, and students love him. I know FMG students, when they're in his classes, they get super motivated. And Porwal sir, I have a request to you, to say guiding words to the FMG students, how now they can, take their journey further from here.
So good evening, sir, and thank you. Good evening, everyone. See, the purpose here is that we are dealing with the FMG champions. They already cleared their FMG. So the main thing which is in the mind is that NEET PG or NEXT. So of course, internship, along with the internship, they should not stop their rhythm. Already they are in a pace. So they should utilize this time in mostly integrated videos, because almost I have seen the level of questions are almost the same. The only difference what I have noted is that in FMG, they have to just qualify 50%. In NEET PG or NEXT, they want more score. But the level of questions are almost the same. So I will just advise them not to change the notes. They can add on more points. Otherwise, they have to start from A to Z again. So they should just add on more points and keep on doing the MCQ. Along with, for example, we have done a lot of integrated session in our app. I have done with the Dr. Sandeep sir and Dr. Nileshraj sir about the Bartter syndrome. So in that, I have discussed about the counter current mechanism. Sir has told about the Bartter syndrome. Nilesh sir has told about the management part. So like that, we have got a lot. And there are so many, integrated sessions in the app also. So they can see those apps. Because after finishing FMG exam, they have a level. And I've seen the level has increased a lot. Now what they are doing is that they are working more than our IMGs. I have seen that. They are really working very hard. So they should not think that NEXT or NEET PG is completely different. It is almost the same. So without stopping the rhythm, they should just keep on motivated and just keep on adding the notes and practice more and more MC.
Wonderful. Porwal sir, beautifully told. And this is a very common question asked to us also. Is the FMG content same as NEET PG content? My very clear answer is absolutely, it's not the same. We have to go to higher level. As sir said, FMG, you have to screen is like 150 out of 300, but NEET PG next will be highly competitive examination. So guys, when you are now starting to prepare for the NEET PG or next examination, you have to see the same content. But if the faculty is same, you can add the notes onto the existing notes, or if you are studying from newer faculty, create the new notes actually. And you must do multiple choice question right from beginning. Make it a habit. You should do multiple choice questions also. Guys, when we discuss about DocTutorials, our idea is to tell you that we are not just a coaching or teaching platform. It's an e-learning resource with a lot of passionate faculties to mentor the FMGs to make sure that they can really do brilliant in their life. I will request our pharmacology teacher, Nileshraj sir, to tell us some salient features of this e-learning platform.
Hi everyone, and hearty congratulations for those guys who have finished off their 2022, and still more hearty congratulations for those who are going to be clearing up for their 2023 and 2024 exams also. So at present we are here. Of course, you can see the list of faculties who are there in your display. With this, I think is none of the other areas can see this much amount of unity to say regarding the faculties which we currently have. And with this display which we have, we can clearly understand that how much this videos is going to be. There will be a lot of issues like certain videos, they are certainly different by certain faculties. By one faculty saying a different thing, the other faculty saying a different thing. No need to worry, because that's what the concept of DocTutorials is. We are all sitting together and developing a material, and so that the students are not going to get confused. Before that, we shouldn't get confused of what exactly we are going to teach you. That's the advantage of what we have currently with DocTutorials, point number one. Point number two, how about the videos, sir? Everyone will be having the same question, like what about videos? How much time it will take for me to complete a single subject? I will tell you the primary concept of making sure that the videos is going to be very much concise and crisp is especially for the FMG students. Why? Because we are recording it separately for the FMG. It is not going to be a same thing for the NEET PG, because we know the differences between what exactly is needed for what kind of students we are going to be focusing on. And of course, as Rajiv sir clearly told that what about the preparations for FMG and NEET PG is going to be same? Is it going to be different? Of course, it's going to be different. But how come this difference is going to be handed upon? With the help of this curated and a comprehensive question bank. Thousands and thousands of questions. Even yesterday, we added 10 questions to the question bank. From pharmacology, I added 10 questions to the Q bank. That much amount of updations is going to be happening daily and daily with recurrent works, which has been there for long, and it is going to be there throughout. And regarding the faculty, we all know that there is no words to explain regarding the experience of the faculties which we currently have, and most importantly regarding the test series. See guys, test series, how much is going to be important? I think I will ask Raju sir to put up a separate question for that. How much important is the test series? Because this test series that is going to be there in our app is going to be curated in an individual manner, in a personalized manner, so that all the previous year questions have been asked at least for a period of 10 years, or to say 15 years of time. All the questions, all the syllabuses is going to be covered up in those test series which has been decided. Above all, our motto, which means there's one thing which every individual faculty will say that we are proud and we were extremely happy to do that, is the IMDb sessions. Integrated MCQ discussion videos, which was very much fun to do, which was very much loving to do, and you can actually see how much interest which we had in our eyes when we were doing that IMDb, because that much amount of subject we started learning for teaching. And to just add a small feather to that cap, we have a specialized concept called as QRP, which of course you all know that, quick revision program. If at all you have finished up a perfect syllabus and we have a very short period of time to just come up with a better improvement in your marks, you just go up with the QRP, which is going to be a best thing, the best thing. If I was in your position, I will be there taking up the QRP and taking up the full complete session, because that's going to be the best thing which I'm going to do in my life. Thanks a lot, Rajeev.
Wonderful, Nilesh sir, to tell us the salient feature. The idea is not to, really tell that we are doing. So please see, I am really proud to be a part of this team over, which you see on the screen. Being available at 9 p.m. in the evening together shows that each faculty member is passionate about delivering the best to the FMGs. And as Nilesh sir is telling, that the app has been designed in such a way that we are able to maximally contribute to your understanding and success in the future also. Guys, whenever it comes to the app or notes, one query I always get is, sir, we have read once actually, but we are unable to revise. Now, I'll request our physiology teacher, Nilesh sir, to tell us that how, the DocTutorials app is going to help them in this particular regard, that the revision can be also made easier. Sir.
Hello, friends, and once again, congratulations to all of you. Like Rajiv sir said, this is one of the very common apprehensions in the mind of all the FMGs, that if I want to crack the NEET exam in one go, then how I'm going to cover all the syllabus, or if I've read it once, then how I'll be able to revise it, because all the faculty will continuously tell you, if you don't revise, you will not be able to reproduce it in the exam. Just reading it once will not help you. You must have at least 2 revisions. Before that, reproduction in the exam is very, very difficult. You are able to answer what you have revised. So here it becomes very, very important to select your resource in such a manner that after reading it, you are able to revise it. If you have a lecture series going into 200, 300 hours, and you want to revise it again, it is not possible. So you have to select very intelligently a resource which covers the same material in, let's say, 40 hours. So if I give the example of biochemistry, I can teach the topic of classification of enzymes in 1.5 hours, but for the exam, I can cover it in 15 to 20 minutes. So you have to choose the content where the same thing is covered in 15 to 20 minutes rather than going for a lecture for 1.5 hours. Everything is in front of you, but you have to make your choices very carefully, keeping in mind our end goal. Our end goal is not to write a thesis. Our end goal is to clear the exam. So we have to choose the content very carefully, which will give us the maximum output, and it will give the maximum output for our input of time. So in limited amount of time, if we are getting all the content, all the major topics are being covered, that should be our choice. And previously, Dr. Nileshraj has said, we also have even shorter versions, which we call the quick revision program for the last round revision. Once you have done the primary conversation with the faculty, then you have done a revision. For the last few days revision, we also have what we call the quick revision program. The same faculty are further concising all the content, highlighting the very high-yield topics and the most important topics for you to review very quickly just before the exam. So I would say this should be your approach for your exam, to cover all the important topics in limited amount of time.
Absolutely, sir. Very aptly said by sir that, when it comes to content, when the number of hours of videos are lesser, the first question a student will have in mind, is the content less? Is the content, having some shortcoming? And no, the guys, faculties have been doing this for ages now. But the same story can be said in lesser number of words without losing the content. Please understand it, because we can say the same thing in maybe 10,000 words, but we can say the same thing in 1,000 words. Why we want to say in 1,000 words? Because we want to make sure that you get the material which is easy to revise multiple number of times. Guys, revision is the key to success. If you don't revise the content 3 times, believe me, it won't stay in your head. And that's what my learning is as an educator for last 18 years. That main thing is revision. So that's what sir is saying, that, don't worry. If the content is precise and concise, does not mean that you're losing the data. No, you're having the same content, but in lesser number of words with proper understanding, with clinical orientation by IMDVs and other like things, and with the possibility of QRP at the end of the program when you are just very close to examination. Guys, integration. That's the key now. And national exit test is just around the corner. Pathology, pharmacology, physiology. These are the 3 fundamentals, of medicine surgery. We all know it. We don't. I always say MP3. Like MP3. Medicine is pathology, pharmacology, physiology, and we have our very special, like motivator, guide, and teacher, pathology teacher. And you would have seen on Instagram also many times, Vandana ma'am. She puts very interesting questions for all of us to really, learn from them. And ma'am, I would request you to guide the students how pathology is important to understand surgery and medicine, other subjects also, for the NExT and the NEET PG paper in future.
Thank you, sir. First, congratulations to all the students for clearing the FMG exam. Now, once you have cleared the FMG exam, guys, so now we're going to start your internship. So internship is one place which will help you learn more. So patho stands for patho, P-A-T-H-O, isn't it? So P means precise. First, be precise. You should now know what to read. So you should be very precise that what are the topics I should be knowing, okay? A is active. Be active in your intern clinical practice. Look at the patient. Once you look at the patient, just see, okay, I'm seeing a patient of backache. So he's an elderly. He might be a case of myeloma. So pathology is not only about slides, it's about techniques. So you should know, okay, this could be a case of myeloma. I have to get Benz-Jones protein. I have to get serum protein electrophoresis. And once you see that case, come back and read that techniques, okay? And just make sure that you make T is for tabulation, okay? Tabulate everything, okay? Make your flashcards, make your tabulations, make sticky notes, stick on your notebooks so that you remember that, okay, once I'm seeing a myeloma patient, I have to do these pathological investigations. Same thing with the radiology also. I'm sure Khaleel sir will also say the same thing. So you have to see the radiology and the pathology at the same time. Tabulate them at that point so that you know, okay, this is the case, I have to do this. Same way with the surgery, you're seeing a thyroid mass, you're going to do an FNAC. FNAC is not given in your textbooks, okay? But there are so many questions which come on cytology now. So go back to the content, see, okay, where is the cytology given? Okay, so this comes out as a papillary thyroid carcinoma. So how is the radiology? How is the histopathology going to be? When you look at with the case, you will remember that for life and you will never forget it. Okay, so PAT, precise, active, tabulation. H is for hemat and histopath. Okay, so cyto I've just told you. So histopath is very important. Once in my life, I saw a case of bulla. Okay, I am sure Dr. Pallavi will be able to correlate. And that bulla was there, all of the body with the mucosas also. And I saw that case and I was like, see, oh my God, this happens. Then when I went to, the report came out in histopathology, there was written immunofluorescence was done. I saw the report. And from that time, from my internship, I have never ever forgotten how does a pemphigus vulgaris looks like, because I saw it in my internship, never forgotten it. Same way, I was posted in a PHC at Tudia Road. There was a female who came with, small child with grape-like lesions coming out from the vagina. I saw it there and I said, what is this? I've never seen this case. When I went back and read it, it was embryonal rhabdomyosarcoma. And I never forget it, that how it appears. So be active in your internship. Whatever case you're looking, come back, read that. What is the pathology? What is the cytology? What is the radiology of it? And then you will remember. So PATH and O is observe everything around you. And remember, this observation is going to stay with you forever. And you should know that these are the common things. They're going to ask you common things only. They're not going to ask you very hi-fi things or very tricky things. Remember, so revise, tabulate, make flashcards, and draw a lot of images yourself, because once you draw by yourself, you will understand the colors of pink and blue. Okay, that is very important. Make your basics clear. Okay, once your basics are clear and your cases are clear, and then only you will be able to correlate with the images well. So that's what I think you should know how to study with integration. Integration is the key to learning. In fact, nowadays we basically teach everything in an integrated way, because that's the way in which you will learn any subject.
Thank you, Vanda ma'am, for highlighting the role of integration to solve the multiple choice question also, and for the clinical life as well. Friends, we have got dermatology, like a wonderful subject, really, precise, concise, and easy to score also. And we have Dr. Pallavi ma'am. I would request Dr. Pallavi ma'am, to say few words of encouragement to all FMGs, because our dream is also this, that FMG, IMG differentiation should end actually. Like people have got the liberty to get educated anywhere in the world. India is one of the options. Right now I'm sitting in Canada. So people are doing a lot of things nowadays. This whole thing that FMGs can do this, IMGs can do this should die down. And I would request Pallavi ma'am to give very, genuine advice to all our FMG champions, that think bigger. Ma'am, words of wisdom from
Thank you, sir. Congratulations to all of you here. Super duper congratulations on you being finally eligible to practice your dream in this country. And in this country, what? It is your country, right? So wherever you've gotten your MBBS from, you will have all the right to practice in this country, barring this one exam which you have to clear. And I am sure that the only difference maybe when you enter into internship is the amount of clinical exposure that you've got in your MBBS. The knowledge you have studied the same books, the same content as any student doing their MBBS in India. So the knowledge part is same, your intellect is the same. Only difference is perhaps some bit of clinical exposure that you get there versus what you get here. And the moment you enter internship in a good hospital, that difference also starts getting blurred because you get exposed to every branch that is, a part of your internship. You get the clinical exposure, you learn whatever was lacking on your part at that point, or maybe nothing was lacking, you better hone your skills. So at the end of internship, that differentiation between being an FMG and IMG, I think, finishes. Provided you do your internship well, you go through the content given in your e-learning platform and DocTutorials good. I will say that use that content even for improving your clinical skills. The content that we teach here is, yes, it is very good for the MCQs, for the entrance exams, but the more you learn on the platform, the better doctor you become, because those skills and that knowledge you use in your clinical OPDs as well. So talking about the difference between an FMG and IMG, I think the difference only ends at the screening test. The minute you enter the clinical departments, the hospitals, you both become similar. So that thing should go out of every student's mind. The dream is common. You all want to become doctors and you want to become good doctors, and nothing can stop you from doing that.
Wonderful, Pallavi ma'am. And I would say that is one take-home message for all of us. Let us end this difference between FMG and IMG, because that absolutely is our vision actually, that everyone who is actually getting trained outside but is clearing one exam, now we all are equal. And believe me, trust us, that is what we are really working for. And this result has proven that FMGs are doing wonderfully well. And the paper was not easy. It was a tougher paper 2 especially. In spite of that, so many people passing the exam has shown that, the things are on the right track, and we would definitely take it forward. A lot of people are doing post-graduation, courses in this country now. I went to KIMS Hospital in Hyderabad for some recording for clinical cases. One of the PGs working in the department, she said, I am your ex-student FMG from this country. I was so delighted to see that. And it's not just one example, many examples. There are people who are doing MD medicine in AIMS also, who's an FMG. And there are so many stories to look. Now let us target higher. Let us dream bigger. That's very important. And my dear friends, subjects of, pathology, microbiology, physiology, biochemistry, anatomy, they are all the pillars of the clinical subjects. And when it comes to, microbiology, we all have, this, fear. We have Dr. Supriya here, a very passionate educator in the field of microbiology. And let us hear from her some words of encouragement. Supriya ma'am.
Thank you so much, sir. First and foremost, I would want to congratulate all the students. It's a great feat. It's not something that you can consider very ordinary. So it's a great feat. I totally understand the amount of effort you must have put in. Now, coming to the clinical subjects, with due respect, we would want to say that, lots of the second year subjects when we were studying was much different. The approach was different, especially when it was dealing with microbiology or pharmacology. Nobody ever told us that this could be something that could have a clinical implication. But now it's changed completely. Now you have biomedical waste management, you have antibiotic stewardship, all of these new topics which have come into play. And this has become more a clinical subject in its own way. So one of the most important things that we have to understand, and that most of us are emphasizing, is the integrated teaching and integrated learning. This has become very important because diagnostics gives you 50% of the final diagnosis as well. So we probably are in the background, but we still have a very big say when it comes to the final diagnosis. So understanding the subject from the basics, and then probably putting a step forward, and then having a clinical approach to it. That is, in fact, the best way of learning. And this kind of gives you a comprehensive understanding of everything. So this is something that you have to remember when you are doing your internship as well.
Wonderful, Supriya ma'am. Guys, I would like to highlight one more thing. For example, next is coming the huge need of understanding the, patient in a proper way. So at DocTutorials, what we have done is we have recorded surgeries right in the hospital. It's not just that, like only theory. It's proper mentoring actually. If the clinical experience is somewhere lacking in the training of FMG, what we are doing is we are putting videos and all over here, in the app only. Like we have recorded surgery videos, we recorded ENT surgery videos, how to examine the patient, instruments of the of ENT surgeries and all that, ophthalmology, how to approach the patient, pediatrics, how to approach particular disease patient in the hospital setting. Guys, that would be actually bridging the gap. The gap, as a lot of faculty said, that you have to bridge the gap between the clinical exposure being less and now it's requirement for the exam and clinical life. And we have that provision because we go to the hospital, record cases, put in the app. That's what we are trying. That is making us ready for the national exit test. Now everybody, I'm sure, national exit test, which is being discussed at every corner, is one thing which is actually, I would say, some question mark. How to prepare, how to approach. A lot of questions are there, and we have our very beloved teacher of radiology, our mentor, Dr. Khaleel sir. This is what I would say, one of the very important messages which you all need to say. Let's understand NExT from sir. Let us get guidance from sir that how can you approach NExT after this particular thing is over in your life. Let's hear from sir. Dr. Khaleel sir.
Yes,
You're
sir.
guiding word for next, sir.
Yes, sir. First of all, heartiest congratulations to all the FMG aspirants. Really amazing results, and this success has been astounding and very encouraging. But one thing I would say: let this success not be the end. Let this be a beginning of a new start. And I hope you all have the realization how the magic of new beginnings work. So please do not stop here. Really amazing, really, heartfelt. We all were so happy to see you all guys clearing, and many students have scored more than 200 marks and very good scores also. And that gives a lot of encouragement and, to go forward and pursue what all you have been dreaming of. And first of all, remove any stigma that you have. You all are very well knowledgeable now. Right? Even when we were preparing in our final years in Indian medical systems here, we were only doing theory. You have been doing MCQs, and the papers that you are going are on par with NEET PG. If you are still very confused, open a NEET PG previous year paper. You will yourself feel that yes, it's a very doable exam. So let's go with that positivity. You all have got this success. Use it as an impetus to move forward in your life. A couple of years, I would say, if you can focus with your same discipline, motivation, and you take care of the effort and energy that you have kept in for last few months to clear this exam, a lot of knowledge is already there. And once you use this to clear your next and the upcoming NEET PG, this will help you, as sir has mentioned, a lot of students we know that have been, successfully practicing in different medical colleges as postgraduates. People have cracked into MLE, people have cracked into NEET PG with very good and astonishing numbers. But when you come to preparation, each exam, your approach has to be different. And you have to understand the exam pattern, and you have to understand what your strengths are, what your weaknesses are, and work on them. With NExT, the proposed draft that is there, you have to understand the 11 subjects that there's a lot of focus on, especially ENT, Opthal, right? Your medicine, surgery, OBG, PSM, and the allied subjects, radio, ortho, anesthesia, derma, psychiatry. So along with that, the applied aspects of your basic sciences. So your focus should be on getting these core subjects very well done, because the exam is not just asking about a cumulative score. Like it's like a university exam for the third year students that they have to pass with 50% marks in ENT, 50% marks in ophthalmology. So your preparation strategy should be in that fashion that yes, you are not just having a cumulative approach. In your FMG preparation, you must be having some strength areas, some weak areas. You may not have done some subjects well. But when you're coming to NExT, please understand this is a competitive exam that you're writing. You may be having a negative marking. You may be having a, each mark deciding which college you get into, which branch you get into. So there is no scope of missing out on any subject. When you're reading your basic subjects, look at the clinical approach, right? And when you're going to your clinical questions subjects, give more importance to the areas which were not being regularly touched on the, FMG preparation, like the instruments part, we don't do much, or any kind of, details of surgeries and stuff which are expected at this level. You can put in that effort to, streamline that thing. So first thing, each paper is to be scored more than 50% as far as the given guideline. If any changes come, we'll all come back again and interact with you with the model. But for now, start from your ENT, opthal, medicine, surgery, pediatrics, ortho, all the allied subjects, right? Try to complete them. And when you're studying your basic subjects, please do revisit your notes that you have made during your FMG preparation. Just have a, skim through that. This is all your property that you have made of all this hard work that you have done. Don't lose it. Just you have to revisit that so that you can brush up fastly and work on the clinical aspects of anatomy, clinical aspects of physiology, so that when you're going into the examination, you're well prepared. And I feel the DocTutorials has the entire thing ready for you. There's a lot of work being done to see that there is integrated videos, integrated questions, the clinical approach to the whole concepts, a lot of surgery recordings that have been done, a lot of instruments that are being recorded, and the teamwork that you will see throughout this journey. So we'll be with you for the next phase of your preparation. And I hope you will enjoy, and we're all there available to you. All of us, you can easily communicate and reach out to us, and we'll be there to assist you in that pattern. But, please believe in yourself first. There is no bias. You're already very good. I can assure you, I met some students, they were telling me, sir, we are doing internship and we are answering much better than the Indian students there. So that knowledge is already there with you. You just have to back yourself. You have to believe in yourself and go get greater heights in your lives. Okay. All the best, guys. Thank you so much.
Thank you, sir. Thank you very much. Guys, I would like to share as a student, if new exam is coming, national exit test, I'll be scared. Who will be there to guide me how to approach that exam? So that's what we are doing as a team over here, because each member wants that, over here, that we should be able to, help the students in such a way that, they are not scared. In fact, they're excited about the exam. That's what we want to create over here. One last one-line message from each one of our faculty members, so that we end this session on a very positive note with a lot of encouragement for all the FMGs to gear up for a bigger dream in their life, actually. Sir, JP, sir, may I start with you, sir? One last, sir, you're mute, sir. You're mute. Yes. Yeah. So you're mute, sir. JP, sir, you're mute.
Sorry. What I have seen is most of the students take a lot of stress during their preparation. What I say is, when you prepare for your entrance examination, never ever think about the result. You just do what duty you are supposed to do, what you're indulged in. For example, as of today, you are supposed to do the internship. At the same time, during internship, you learn the clinical scenario. At the same time, if the discussion is going on in the medical college, then you join them because you understand better when you approach the patients along with your clinical knowledge. Meantime, once you are free after your duty hours, don't waste your time. Just start from the basics. At the same time, keep proper concept about the subject. Never ever think about whether I pass or not, whether I get eligibility or not, whether I get a good score or not. And one more thing I tell you, never ever feel in yourself inferior to anybody else. Only thing you have to do hard work without any stress and tension. Like always I say, be cool. That's what. All the best.
Sandeep Sharma, sir, one last message for all the FMGs, sir.
Sir, the only message I can say is, now it is time for you to dream big. Because if you have to become big, you first have to dream and believe in yourself. Then try to match your efforts according to whatever you have dreamt. and do not settle for mediocrity. Now it is time for you to cross that mental barrier and go for the, what they say, go for the kill now. One last exam. After that, decide karna hai, nahi karna hai super specialty.
Deep sir has summarized beautifully. Don't target mediocrity. Let us dream big. Mahendran sir.
Hi friends. The most important thing is exams will come and go. Enjoy your life day to day. Daily enjoy your life. Daily you should sleep smiling, not with a depression. That's the most important, because the learning exams will come and go. But as a medico, you should know the stress will be always there until you die. Your patient-related stress, everything will be always a stress. Especially when you become a surgeon, the day without stress will be very less. So this is a period where you can enjoy the utmost. So enjoy. All the best. Thank you.
Yes, this is called mentoring. Sir is MCH gastroenterology, which can be anybody's dream too. He's summing up his story that each day is important. Let us, do well for our future, but let us live today also. That's very important. Okay. Vanda ma'am.
I will say dream big, be mentally strong, and I'll say picture abhi baki hai mere dost, clinically correlate karo.
That's amazing. Shivani ma'am, you're mute ma'am. Shivani ma'am.
Nothing. The most important thing is that you have to believe that you can do. If you believe your work is half done, okay? So this is what I believe in, and सोचना यही है कि कर सकते हैं और करेंगे भी और करके दिखाएंगे. So this is the last thing.
We believe in you. Most importantly, we believe in FMGs that they have the internal strength to do bigger thing in their life, and that's, as Shivani ma'am is saying, you also believe yourself. Supriya ma'am.
Yeah, I think to summarize what everybody has said, it's totally about a mind game. It's not just about going and writing the exam. It's all in the mind. And you have to be able to take failures. Sometimes that is also part of life. So take failures the way it comes, and you have to move on from that as well.
Wonderful. Pallavi ma'am, one final comment.
Yes, so I think everything has been said till now by all the faculties, and I will just tell the students to keep faith in yourself, believe in yourself, but nothing beats hard work. So keep working hard. Okay, don't ever just leave things to fate and give up. Ke jo hoga dekha jayega. No, your destiny is in your hand. You have the power to make it. So just work hard. Enjoy bhi kar lena thoda thoda. But
yes. Nilesh, Chandra sir.
Much has been said, and everyone has rightly said. We all believe in you. Only thing I would say is your success in your hands. You have to plan for your success. If you don't plan for your success, then if you fail to plan, then you're planning to fail. So you plan your success, make a timetable, stick to that timetable, and have faith in yourself. You will come out with flying colors without any doubt. That's all.
Yes. Porwal sir. Naveen Porwal sir.
Yes, sir. So I would say that we are not a scholar. We are going to become doctors. So I've seen some can be a good knowledgeable person, some can be better administrator. तो सभी कुछ ना कुछ अच्छा कर ही लेते हैं. We should not compare. एंड में चल करके कभी हम देखते हैं कि जो स्कॉलर अच्छा नहीं था MBBS में, वो बाद में उसने नर्सिंग होम बना लिया. या जो MD 3 साल के बाद निकाला, he is doing much better than जिसने फर्स्ट अटेम्प्ट में निकाला. तो कभी we should never underestimate कि अभी उस मुझसे आगे है तो आगे भी मुझसे आगे होगा. इट इज लाइक अ सर्किल. बहुत आगे जाता बंद पीछे हो जाता है. तो इट इज नॉट लाइक दैट अभी आगे बहुत पिक्चर बाकी है, जैसे कि वंदना मैम ने कहा. तो वी शुड नॉट अंडरएस्टिमेट, वी शुड नॉट कंपेयर. एवरीवन इज अ यूनिक फ्लावर. तो वी शुड फ्लावर लाइक इन दैट मैनर. तो नेवर एवर कंपेयर, नेवर एवर गेट डिप्रेस्ड, व्हाटएवर. आगे चल के सब अच्छा ही होना है. तो अभी हमको टनल विजन दिखता है कि FMG 1 साल में निकला, 2 में निकला, 3 में निकला, या PG में कैसे होगा. आगे चल करके मे बी ही माइट बी बेटर डॉक्टर, माइट बी बेटर टीचर, और माइट बी बेटर एडमिनिस्ट्रेटर. सो जरूरी नहीं कि हमसे मार्क्स के बेसिस पे हम किसी को कंपेयर कर सकें. सो दैट इज दैट वी आर हियर टू बिकम डॉक्टर, नॉट स्कॉलर.
Wonderful. Friends, I hope you can sense that, passion of all faculties. I hope you can feel that it's not just about educating someone, it's about mentoring also. So that I hope you are able to sense that, spirit of, training, mentoring, and, taking you further in your life. That's what the team is all about. Nileshraj sir, final comment, sir.
Guys, actually, we are doctors. We are designed to face problems. No one is going to be coming up to your clinic and say that, sir, I'm feeling very much happy. I just want to see you. That's it. No one is going to say that. Everyone is going to be coming up to you with some problems. You are there to deal with problems. We are designed to deal with problems. So why should we run away with problems? Just learn how to deal with problems. Just solve all the problems. Keep your chin down. Read as much as you can. Keep your chin up. Enjoy your life as much as you can.
Wow, summarized in one line, sir, wonderfully. Sir, final words of encouragement from Khaleel, sir.
Yeah. So enjoy your success, guys, and take out time during this to meet all your old leftover friends, relatives, family. I think last 6 years has been very, very stressful for all of you. But again, come back on track and go on for this mission. Okay, and there's a few words I would like to say. कुछ देर की खामोशी है, कुछ देर की खामोशी है, फिर शोर आएगा. उनका वक्त आया है, हमारा दौर आएगा. So giving your 100%, then there's much more to achieve. God bless you all.
Wonderful. Thank you, everyone. Thank you, each and every faculty member of DocTutorials. Thank you, students, also for listening to us. And I'll just end this session with only one thing, which is a message from all the faculty: also dream big. And you can do it. When you were doing FMG examination, you were feeling as if it is not doable. And today we have got many people who have scored above 200, who have really done exceptionally well in spite of such a tough paper. That really makes our confidence in you guys even more deeper and stronger, that you have that mental to make the things happen. So let us do things together. Let us walk together now further. Celebrate this moment, be with your families and friends and enjoy this, feeling that you have done it. And then look now at the future, that where we are going. And let us, join hands over here to make this learning fun and make sure that we are getting the good information in the way it should be really easy to revise also for us later on. And let us be in touch in the coming, many years also, so that we see you doing wonderful work in the field in this country. Thank you very much, guys. Thank you, every faculty member.
Thank you, everyone.
Thank you, everyone.
everyone.
Do well. Bye.
Thank you. Wish all the
All the
best.
best.